Hello, I'm Luke O'Neill and here I am in my lab in the Trinity Biomedical Sciences Institute. So this week on my COVID-19 update, China. Now we know China has lots of vaccines. They've just approved 2 more. So there's 4 vaccines now approved in China. 2 of them they're giving to many countries all over the world. 20 countries now have been given either Sinopharm or CanSino vaccines. Highly efficacious, looks very safe. 40 million people have been given these vaccines in China. So the question now is, will China make their vaccines available to other parts of the world, maybe even Europe? And of course we've got the Russian vaccine Sputnik V. That's now been approved in over 30 countries, highly efficacious. And again, the Russians are looking at doing deals with Europe and the US to make their vaccine available. And what's going to happen, I think, is by about May, June time, we may well have the Sputnik V vaccine in Ireland, given that so many different countries have approved it. And the EMA is now examining that vaccine very closely. So more vaccines coming down the track. And more data on men versus women. We now know men are at a 20% increased risk of very severe disease and death compared to women, and that's been proven across many different populations. The big question is why, and there's some very interesting answers. First and foremost, it turns out that sex steroids that women have, like estrogen, are actually very good at maintaining immune health. And they've shown that women who are on the contraceptive pill, who have higher levels of estrogen, are actually protected a bit from COVID-19 because of all the estrogen helping their immune system. Secondly, when women pass through the menopause and these steroids begin to fall, they become at the same level of risk as men. So it could well be something to do with estrogen. Of course, would that mean we can use those steroids now to protect people? That's one possibility. The second aspect is women have 2 X chromosomes, whereas men have 1. And it turns out many important immune genes are on the X chromosome. So women are getting a double dose of that immune gene. One example is a gene called TLR7, which we work on in my lab actually. That's on the X chromosome. So women have 2 copies, men have 1. It's like you've got double the level of troops, I suppose, fighting the infection. Now what this means is the women can ward off the infection more effectively and get over it more quickly, hopefully. But one consequence might be long COVID. And that's more common in women because they've had too strong an immune response, which is very interesting. And again, there's a clue there as to what's going on with long COVID. So on the one hand, it helps them fight COVID, and they don't get as much severity and death in response to that virus, but they pay the price potentially of more persistent symptoms and then ultimately maybe a risk of autoimmunity. So yet again, the immune system lies at the very heart of our understanding of this disease. And then most importantly of all this week, the CDC, which remember is the world's most important infectious diseases institute, really eminent. They've just issued guidelines on what to do now that you're vaccinated. And it's very interesting. Their first guideline is, if 2 people who are vaccinated meet up, now fully vaccinated, meaning 2 doses, they don't need to wear masks, they don't need to have any social distancing indoors. That means you can hug your grandmother if you're both vaccinated. Secondly, if you're vaccinated and you meet someone who isn't vaccinated, but they aren't in a vulnerable group, which means they might be younger, they know extra diseases, again, you can breach the social distancing guidelines and you can not wear a mask. So we're going to see in the coming weeks actually more and more guidelines from the CDC and ultimately in Europe as well to say what the vaccine bonus is going to be, and that will come to Ireland as well. So you can hear about these stories and more on my weekly COVID-19 update with Pat Kenny on Newstalk.